live of this particular week of social distancing. My name is Dr. Dave Anderson. I'm a clinical psychologist at the Child Mind Institute and our Senior Director of National Programs and Outreach. We're a national nonprofit that supports children and families with gold standard mental health care, advice, and resources, all online and accessible to everyone. During the coronavirus crisis, our telehealth resources include the diagnosis and treatment of mental health and learning disorders, 30-minute phone consultations related to stressors around the coronavirus crisis, bereavement and grief support, especially for those who've lost loved ones, and remote neuropsychological evaluations. And that's just a sampling. Please visit childmind.org/telehealth to learn more. Today on Facebook Live, we're going to be talking about teens and their social lives. Now, I want to say we have some prepared questions that we have at least collected from our audience or from previous Facebook Lives that have been asked about teenagers and their social lives. But please post your questions in the feed. I have a colleague, Jason, who's able to feed questions in the event that you post questions or comments. And we'll also post some links during the Facebook Live to helpful resources on childmind.org. Remember, we're here every day, and even though we may only be together for a few minutes here, on Facebook, we look through your questions daily, and we try to get what resources we can to any community that we can reach. So with that, I want to launch into a little bit of a preamble around teens and their social lives during this time. Within our clinical practice, we're treating many adolescents. And the reality is that social distancing is kind of at odds with the adolescent developmental stage. So one of the things that we really have to think about is what we're looking at with adolescent brain development, and then what we're looking at with social distancing. So for many teens, novelty seeking, new experiences, reliance on friends are hallmarks of this period. So what we know is that, where little kids during social distancing may really enjoy some of the extra time they get with their parents, as long as their parents' stress levels and emotion regulation are at least somewhat within certain boundaries, they may be actually enjoying that extra family time. Whereas for teens, their developmental stage is about independence and what we call differentiating. It's about seeking out these new experiences, feeling like you can kind of live on your own, imagining what it might be like to live with roommates or to live with a boyfriend or a girlfriend in the future, and kind of practicing more of that independent lifestyle. So the issue here is that for teens, they're going to feel quite cooped up, at least during social distancing. And at this stage, and this is one of the reasons why we wanted to do a Facebook Live on teen social lives, this is a different point for many teens in social distancing than even what was happening in the first few weeks. Because what we heard during those first few weeks of social distancing was that, many teens, the concerns were that they were holed up in their rooms, perhaps watching a lot of Netflix, playing a lot of Fortnite or engaging in a lot of social media. And the thought was that it's the isolation that was a problem. And I will definitely talk about that isolation here in a moment. But what we're seeing at this phase of the coronavirus crisis is not so much isolation, but a lot of parents who are getting pressure from their teens to violate, guidelines related to social distancing just to allow their kids some sort of social life. So what I want to talk about for a second is just some of the earlier issues we saw during the coronavirus crisis that are still very much, at play right now. And then we'll get into some of the things we're seeing now. So the first thing is, when the coronavirus crisis first hit, a lot of the questions we were getting from parents were around the fact that screen time boundaries were being relaxed, because for many teenagers, school time was reduced. Even if they're going to online school, they're not in transit as much, or perhaps the online school days is a little bit truncated. At the same time, extracurricular activities are gone. There aren't as many times when they're hanging out with their friends in the evenings or on weekends. So in many ways, parents were trying to figure out the balance at the beginning between the amount of time their teens were spending on screens for school and, with their friends and to watch various things, and feeling like there was at least some measure of balance there. So what we developed early on in the coronavirus crisis was more of a wellness checklist for parents around what they could think of in terms of the balance their teens might need. So in that sense, we would say to parents, really go through and check the following boxes. Make sure your teens abiding by public health recommendations you feel keep them and your family members safe. So in that sense, we're washing hands, we're making sure that if we leave the house, we're wearing a mask. And that was actually not as much of a recommendation early on in the crisis as it is now. And that we're really keeping our social distance when we might be outside the house. And also avoiding touching our face and eyes, things like that. So it was really, we were trying to help parents promote those health practices to ensure that their teens were staying safe. Then what we were talking to parents about was, before you go after the amount of time that's spent on screens, let's talk about promoting basic wellness practices that are incredibly important during this time for every human, for everyone's psychology. And that means checking in and making sure your teen's getting enough sleep. And I'll talk about how that relates to screens in a second. And it doesn't mean necessarily that they're sleeping at exactly the same time, because lots of teens, their circadian rhythms already mean that they're shifted to a little bit later bedtime, a little later waking time. And to be sure, if their online schooling doesn't have a particular time-dependent moment when they have to start, many teens are sleeping in a little bit later. But it's more about asking parents, is your teen getting enough sleep? Are they eating regularly? And at the same time, are they getting some level of exercise? Either through creative online things you can watch at home, or through walks or runs that also obey kind of social distancing rules. And so once we kind of fill space with these social distancing practices, the kind of basic wellness practices we'd like a teen to engage in, some of the online schooling that likely is occupying their lives as well as their homework. And then what we're also thinking about is how we can help teens to manage their news exposure and ensure that they're not kind of reading so much that it leads to more anxiety and difficulties with the uncertainty of everything, but rather they get the information that they need. And then we also try with parents to figure out, how we can engage teens in thinking about making the family space more of a space where they can be present and not feel like they have to be isolated in their room. Because it's very true that for teens who may be prone to mental health and learning disorders, that isolation could exacerbate symptoms. So what we want to help parents with in thinking about that balance early on in the coronavirus crisis is how you bring a teen out of their room and into that space. And what it means is that we tell parents, during this time, you're still going to have to remind your teenager of tasks they have to do. You're still going to have to remind them of routines, ways you want them to contribute around the house. But the key to keep a teen in a public space in the house is to make sure there are certain times during the day where they don't necessarily have the expectation that you'll be a taskmaster or that you'll be, as they might label it, nagging them about different things that need to happen, but rather that you're engaged in shared activities. And that can be hard, especially if parents and teenagers don't share the same interests. So in that sense, if your teen is playing a video game or they're on a particular website or they're engaged in something online that you don't actually think is that wholesome or interesting, what we tell parents is, still, it's about relationship building. Sit down and try to get interested in it. Make your comments not necessarily criticizing of the thing. Don't ask too many questions. Merely kind of comment on what you're seeing. It looks like you and your team are doing really well in this video game. We know that's going to sound clunky to teenagers, but it is so much less likely to lead to defensive or aggressive comments than, why are you playing this? It seems like a waste of time. It's trying to comment on what they seem to be doing well or why you think this might be interesting to them. Because the more you can make comments about either their particular engagement with it or why you think it's interesting, the more likely teenagers to think that at the moment you're avoiding a ton of rapid fire questions, you're avoiding telling them what to do, and there might be a reason for them to kind of explain to you why this matters to them and what matters in a digital world. And that also helps to kind of keep them in the family space. The other thing that we talk to parents about in that early on kind of wellness checklist is really trying to think with their teen about how they can make family time some quality time. And this can be really inventive in terms of, the teen may not want to spend time with siblings. They may not want to spend too much time at family dinners. But are there activities that once or twice a week you can do together, even if it involves watching something together only, that at least make it so you can be in the same space and that you can have some shared enjoyment? Because that also fills the tank considerably for, the ability to kind of keep a teen outside of their room and engaged with the family. So the reason why we go through this is that for the parents who are concerned about, we've got a question from Bobby. Teens want to plan graduation parties. Okay, be with friends versus social distancing. This is getting to what I was going to get, Bobby, at the end of the talk, and I like the fact that you're fast forwarding me. You're making sure I get to the really, of the moment issues. So after 9 weeks of social distancing, many teenagers are saying to their parents, look, I know my friend. My friend has been social distancing with their family. They've been following the same protocols we have. Why won't you let me get together with my friends? Why can't I have the birthday party or the gathering that I'm kind of mourning the loss of? So I'm going to talk about two things related to this. One is mourning the loss of things that are rites of passage for teenagers. And the other is how parents are thinking critically about this at this time. So for teens in their social lives, first, there are so many things, school dances, proms, graduations, springtime activities, related to school and related to their social lives that they've been waiting for all year. It's the emergence from the winter and the feeling that social lives are able to be spent outside again. And for many teens, we know that these large group gatherings are not going to be possible given current social distancing guidelines. So we have to kind of mourn with them. What we tell parents is validate the fact that this is really hard, that you don't know what you would have done if these things would have been canceled. And you do want to find creative ways for them to connect with their friends as much as they can and to celebrate these moments, but you know that you can't get together in large groups. Now, what I will say is, look, there's this compromise between what we know we're hearing from public health officials and then what families are doing realistically. And I'll say that what we hear many times is that teens are very likely to overrepresent how many of their friends are getting together. To be sure, right now at this phase of social distancing, it's likely that a few of your teenagers' friends are getting together at some level where families have made critical decisions where they've said, look, I believe this other family is following the same social distancing practices. We're willing to take this risk at some level, and we're going to allow the teens to, in some way see each other in person. Many families are still trying to abide by the letter of the law with social distancing in that we're seeing more families say to their teens, look, you can agree on a public outdoor meeting place. You can bring a lawn chair. You can stay 6 feet away from everybody else and wear a mask the whole time. Don't accept anything from anyone else and don't touch anyone else, but you can at least sit in a socially distanced circle or area, while you're talking. And that's something where we've seen families get creative about that. I've even seen teens on my street where they meet up on opposite sides of the street and then make TikTok videos where they're never, closer than 6 feet, but they're making videos together and kind of taking walks. So many parents are starting to allow that relaxing of, still trying to abide by social distancing while allowing these sort of meetups. The reason why you want it in a public place, the reason why you might want other adults around, things like that, is because, look, teenagers are prone to feelings of invincibility and feeling like, the rules may not apply to them. Or especially in coronavirus crisis, we're hearing from many teenagers that they expect that they're not as much medically at risk as others. And they may not understand the collective agreement we've all made to social distance, not so much because each of us is at risk, but because of the people who are most at risk and how we don't want to spread this disease. So truly, some parents are relaxing in that way where they're still trying to abide by social distancing. Other parents, realistically, and we're not saying we support this practice, are allowing their teens to identify either their boyfriend or girlfriend or another best friend of some kind and saying, we'll allow you to get together with just that person. But make it a person you want to get together with over and over, because we're not broadening this circle. We're making a critical decision about, whether or not you're going to be able to see someone, because we know that's going to help you with your psychological health. But at the same time, we don't want you to think this just means the floodgates are open and you can start getting together for parties. So now we've got a good question for Greg. How do I comfort my daughter about the possibility that school will be remote in the fall? Right. So, Greg, this is a really good question because when we look at what kind of uncertainty we have right now, we're still waiting to see whether or not there's going to be the possibility that camps or gatherings that are social over the summer can even happen, even with the risks that we know might be inherent and the guidelines that camps might be following. We also know that many school districts, many colleges are making, very important decisions right now about whether or not they can have children together, what practices they might need to change from preschool on up to college years, related to large group gatherings, testing, people they allow in the building, all kinds of things. I think one of the difficult things that we know right now is that unless a school or college has said what their policy will be for the fall, and the vast majority have not, we're tolerating uncertainty with our teens a lot right now, in the sense that we may have been getting through coronavirus by saying to ourselves, this will change soon enough. We're eventually going to get back to some semblance of normal. And I think some of the disturbing news over the last few weeks has been that even as we all have been social distancing for this long and feel like we deserve a break or we must deserve some return to normalcy, the reality is that the medical data here may not inform that. And that's going to be a really tough compromise for all of us. So for kids who are worried that their school, may not necessarily be in person again in the fall, I think what we have to tell them is kind of own what we don't know, that we don't necessarily know exactly what it's going to look like. We know there are still many, many weeks and that a lot of the news around this pandemic changes week to week. And at the same time, we are devoted to A, finding ways to support them, and B, finding ways to help them to get out of school and peer contact what they would have hoped to have gotten by the fact that school's in person. To be sure, and going back to this question, I've heard from many of my teenage patients who absolutely despised going to school or despised certain subjects prior to the coronavirus crisis. They could not be more excited just to get back to the annoyance of school that they previously felt, or trying to see their teachers and have in-person conferences, or seeing their friends between classes. It's, of course, completely normal for us to fantasize about what that could be like when we finally can return to that. And when we keep telling teenagers that at some point we will figure out a way to return to those sorts of things, but it's really difficult that this crisis requires even more resilience of us and even more patience. But what we know is that even if schools decide to engage in distance learning, we are likely to be in a different place come fall, related to perhaps some of the ways that we've been able to reopen sectors of society with a number of different health guidelines and health practices. So it's not something where we want them to think, this is where we get into kind of the psychologist tool of trying to make it so that people don't think in all or nothing thinking patterns. If school is still distance learning, that doesn't mean that all is lost. It doesn't mean that everything will necessarily be at a distance or online. And again, going back to one of the earlier questions, this is, I think, what a lot of parents are really trying to balance, is that they may not know certain things. They may be trying to balance a certain level of, facts that they might have, while at the same time wondering what might still be worked out before the next transition point, or what might be uncertain. And so that's why we look at what we can give parents hope around in terms of how teens might be able to emerge and have their social lives return to some resemblance of in-person contact, while at the same time trying to be honest with teens about what we know and what we know they're going to return to. So I'm going to go back for a second to a couple of the prepared questions that we got related to teen social lives, because I just want to say for the folks, Greg and Bobby, who've been throwing in questions, keep them coming, because Jason's going to keep feeding them to me. But I'll go to some of the questions we actually got even before this Facebook Live here. The first is just a question that we got where a parent asked how they figure out the balance between their teen being worrying their teens left out, while at the same time setting boundaries around sleep for their social life. So this question is one we're hearing a lot about, where a teenager will say, well, I have to have my phone in my room, or I have to be on my computer, or I have to be on social media till very late hours, likely even after parents are in bed or feel like they can monitor this, because that's when their friends are online. That's when everybody is kind of present. And so parents are trying to balance the idea that they know that sleep is a basic mental health and wellness practice for their teen, but at the same time, they don't want to necessarily make it so that they place limits on the only social contact they might have. So listen, our advice in general on those things is that teens are very creative in and around parent boundaries. So we say to parents, if you really feel that the issue is that your teen is waking up very tired for online schooling, or if you feel like it's something where they're not getting enough sleep and that causes them to be irritable with family members, and for that reason it is really impairing family wellness, it's about the teen's functioning. If they're staying up late and then they are a delight throughout the day and they're able to invest in their schoolwork and get enough sleep, you may have hit the trifecta. That means that you've threaded the needle with your teen. But that's rare. So what we want to be honest with teens about is the factors that we care about and how we want the family to feel right now, while at the same time trying to set boundaries around the screen use. So if we tell them, I'm worried about your investment in school, or the amount of sleep you're getting, or your irritability with family members, what we're doing is we're setting up a dual kind of goal-oriented process with it. We're saying, these are my goals. Your goal is to get the social time that you want with your friends. Help us meet in the middle. If you want that time, I need to see these other things happen. If, on the other hand, you cannot regulate yourself on these things, I'm going to have to set a boundary. What we do is we engage teens at the level of independence and maturity they have, which is to say, I'm going to propose to you what my objectives are, what your objectives are, and see if we can come to a compromise. And only after our teenager shows us that they can't engage in that compromise or problem-solving process do we start to set draconian boundaries. I'm going to shut off your phone at 11 p.m. Doesn't matter who you're talking to on Instagram. It's something where we want to be sure that if we're going to set that boundary, especially during something like the coronavirus crisis, where we want to set up good processes of communication, if we're going to set that boundary, we want to be sure that our teenager at least realizes that prior to that boundary setting, they could engage us in diplomacy. And when we tell parents, if you go through that routine over and over with your teenager, trying to engage in collaborative problem solving and diplomacy prior to setting that boundary, what you do is you eventually show your teen there's a huge incentive to meet you where you're at in that first discussion, because they don't know what's going to come up next. And it's absolutely sure that if they don't engage you in that sort of diplomatic stage, they may find they really don't like the restrictions that have been placed on them. So I'm going to go to one more question. Oh, Trevor, my daughter's upset because our family vacation will be canceled. I don't want to build her up hope. Any advice? Yeah, Trevor, this is a good question about family vacations as well. So I'll pause on the question I was going to read. We'll go to family vacations. Look, this goes back to the same uncertainty that we were talking about before, is that we may not necessarily know what travel restrictions will look like. To be sure, it's probable that, air travel, at least this summer, may be to some degree limited, because it is among the most kind of, high-risk activities, at least according to public health officials. But at the same time, that's not to say that families are not finding creative ways to think about how they might engage in vacations. The number of discussions that I've had with families about how they might, rent an Airbnb that they know has been deeply sanitized or has not been occupied for 2 weeks, and they're only going to take a road trip within 4 hours of their house that will make it so that they can either pick up and sanitize food on the way, but won't have to stop to go to the bathroom the entire time. I mean, look, the reality is that people are getting real creative about how they're doing this. I've also heard from some families that they have become more fond of camping than ever, because the chance to go camping may involve social distancing, not touching other, not being near other humans, and a chance to feel like you're at least getting away. So I think people are going to get creative about their vacations while still trying to make sure that they're tending to their health. But it's one of these things where if you have a vacation that's going to involve very long travel or an airline flight, you don't know if it's going to be safe enough. Again, it goes back to some of the points I was making about prom or graduation. You validate the fact that this is hard. You tell them you're mourning it. In this case, with the vacation, you're probably mourning it with them. You know that one day you may be able to take family vacations, in a much more unfettered way at some point, but you're going to try to come up, and this is where you get, in the same kind of zone with your teenager. You're going to try to come up with ways that you all can have a good time, and perhaps, create pseudo vacations or somewhat real vacations once again this summer. And it also is something where I will say one other note that we're hearing from families of teenagers is, look, if you've got family members that have been social distancing for a long period of time and you think they're fairly healthy and, testing gets to be more widespread, and you can go visit those family members, switch houses, go with family members who you think you get along with, that can also feel at least like a vacation because it's a different place. We've got to remember where everybody is right now at baseline, which is most people have been in the same exact place for 9 weeks. And that's something where a little novelty can go a long way and already feel like a vacation. I'm going to hit the last prepared question that we have here, which is that someone had asked before this, my daughter is crushed that she can't see her girlfriend, who's immunocompromised and totally isolated. They talk on the phone and FaceTime every night, but she misses her terribly and is feeling so down. I don't know what to say to comfort her. Help. This is one of the toughest questions. I leave it to the end because the reason why I want to leave it to the end is I want to remind everyone that we as therapists, even though we spend our lives trying to support people through the stressful situation that they encounter, sometimes don't have the answers. This situation that we have a question about here, your daughter's crushed because she can't visit her girlfriend who's immunocompromised, doesn't have an easy answer. It is what it is. And so one of the things that is difficult for all of us is when we have to tell our patients, this is an acceptance and distress tolerance situation. There are moments where we're all active as therapists. We can tell our patients, I'm going to figure out a solution for you, something that gets you, either a decrease in the stress that you're feeling or a modicum of a mood boost in some active way of coping. And the fact is that there are some moments where we tell our patients, we just have to ride the wave together. This is going to be extremely difficult, and what it means is that we're going to have to seek ways of mindfully experiencing joy through the social contact you can have on the phone and FaceTime, but to know that it may be quite a long time before you can be physically present with that person again without putting them at huge risk. And that's something where, it's really difficult just to feel like you can't fix it and to have to be honest with a teenager, you're just going to sit with them in that space. And to know that, the moment that you have a solution for it, you'll go with that. But what we focus on with many teenagers when we can't change things is mindfulness activities. We say, what do your five senses, kind of feed you, even in those moments where you're connecting with that person? We know it's not the physical contact. We know you can't see their entire body language. But what is it about their face that you can experience joy in? What is it about their laugh right now? What is it about the way that they're speaking or their sense of humor where you can say, at least I have that part of them right now, even if I can't have all of them? And that's really how we get people to cope with romantic relationships that are at distance right now. And that's true of teenagers and adults. Many people are coping with the same kinds of things. So, look, I know we're coming to the end of our time right here. So I want to make sure to close by saying that, for all of these questions about teenagers and their social lives, that we have services, as I noted before, like flat fee phone consultations with parents, where if you really feel like you're struggling with some of these, or that my answers weren't complete enough, or something like that, please reach out. All of our services have moved to telehealth, and we have in particular services that are made to kind of try to tackle small issues that may not require a larger conversation with parents. I want to thank you all for joining me. I hope this was helpful. Remember, we're here every day for Facebook Lives. We look through your questions daily, and the Child Mind Institute is here to help with mental health and parenting needs in this coronavirus crisis, no matter where you are in the world. Please visit childmind.org/telehealth to learn more about our incredible variety of telehealth resources for children, teens, and young adults. Be safe, and thanks so much for listening.